Hello friends, this is the picture of a CT scan which is showing the abdominal aorta. So if you see, this is the abdominal aorta which you can see here, right? Now in the abdominal aorta you can see that this abdominal aorta is divided into many segments like this, right? So what are these segments? Here this is a picture of aortic dissection, where whenever there is a small hole in the intima and the blood which is normally present in the aorta, that will streak inside and it will start accumulating in the media, aortic media. So this is the picture of the aortic dissection, where you can clearly see this segment, and this segment is nothing but the aortic intima. If you see, this is the next picture. Even in this picture, this is the carotid artery, common carotid artery, and here you can see that there is a dissection in the common carotid artery and the blood is passing into the media of common carotid artery. So this is the aortic dissection which you can see here. Okay, next. So if you see the microscopic picture, so this is the microscopic picture of aortic dissection. So this hole is the artery and this is the lumen of the artery, and here there is a small break. So through that break the blood from the artery entered the media and it has started extending into the media. So this is the main lumen, this is the false lumen which is nothing but the media. So this is the picture showing the aortic dissection. Next, this is the next picture. Okay, even this is showing the aortic dissection. So if you see, this is the media, this is the media, and here you will have the intima, and because of the rupture, because this is the intima, see this is the intima whereas this is the media. Now because there is rupture here, the blood from the intima enters the media and starts extending into the media. So this is picture showing aortic dissection. This is the gross picture where you open the aorta. See, you can see this is the normal lumen. Okay, this is the normal lumen, but here you can see there is one more lumen here which is false lumen. This is the lumen which is seen in media. Okay, and this is nothing but aortic dissection. Small hole here has led the blood to pass into this media, and this is the double lumen of aorta. This will create double lumen of aorta. So these are the pictures for aortic dissection. Thank you for watching.